Thank you, Daniele. Good evening, everyone, and welcome to our presentation. Let's meet Alice, a person with multiple sclerosis, and Carlo, an oncology patient currently undergoing treatment. Our journey starts with their stories and our goal to improve their quality of life. Soon after we started, we realized that their lives were severely affected by an issue, one that stood out between all the others: chronic fatigue. Fatigue is an unpredictable and recurrent sense of physical and mental exhaustion that interferes with their normal functioning, affecting every situation of their realities. However, it is often minimized and invisibilized by those around them. Alice and Carlo describe their fatigue as: if a healthy person starts the day with 10 blocks of energy, I start the day with only 5 blocks. And they are not facing this issue alone. It is estimated that 80% of multiple sclerosis and oncology patients are affected by fatigue as a consequence of their disease or of their treatment. This means that right now, millions of people are struggling to live their lives with their 5 blocks of energy in a world of people with 10 blocks. For them, we have imagined a new day, one in which they live at their fullest because they can choose how to invest their 5 blocks of energy in what matters most to them. How? With Fuel, a service system that allows patients to understand how their fatigue behaves and evolves over time and the factors that affect it. It also provides them with expert-created suggestions to reduce fatigue's effects and with tools to improve communication with their medical staff and their caregivers.
But for understanding how fatigue behaves and evolves, Fuel first needs to measure it. We know that fatigue for patients may be unpredictable, but it gives away tangible signals. And these signals can be collected by using their smartphones. So we created an application just for that. Through the phone's camera, the app reads the patient's eye blinking rate. It also connects to the accelerometer to detect their physical activities and slower movements. Patients can also actively record their status in the app by taking a reaction time test with a self-assessment of fatigue. And by connecting a wearable, data is even more precise. So we provided a sample of patients with smartbands to access information like sleep quality and heart rate. So we contact Alice and Carlo and all the patients we met along the way, and they downloaded our testing app on their phones. We got the help of the main Italian Patients Association and of about 50 users who perform more than 6,000 tests. Here you can see the numbers of tests performed by our users in the past few days. After this test and a training period, Fuel will be able to predict the patient's fatigue trend across the day and also in the near future. Now let's see how Fuel is helping our patients and their caregivers. First, let's see how Fuel works for the patients. With Fuel, patients can understand their fatigue level, how it behaves, and the factors that affect it. They can access strategies to minimize the effect that these factors have on their fatigue. And since medical advice sometimes doesn't fit their realities, patients can also ask and share practical advice. And finally, they can easily share the complexities of their disease with their medical staff, while also choosing to disclose their status in real time to their loved ones. For the patient's caregivers, Fuel helps them prepare for the practical and emotional challenges to come. But how? By helping them manage all the patient's related tasks, with everyone involved in the patient's care. And since both applications are connected, they can view the patient status in real time to understand how to better support them and cope with it by accessing an expert-created library.
And now you might be wondering, can I use the Fuel app? How is Fuel keeping our users motivated to use the service daily? This and more we will answer during our Q&A later today. Fuel was created by an international team coming from 2 Italian universities working with the support of our corporate partner, Sanofi Genzyme, Italy. Thank you so much for your time.